Welcome to the interview, Dr. Nabil, and thank you for joining us. My name is Katie, and would you like to introduce yourself?
Thank you, Kate. Yeah, it's great to be among you. My name is Nabil Badr.
All right, and would you like to give us some background on you?
Yeah, well, quickly, I've been in this industry for about 10 years as far as healthcare informatics. Before that, I was working with hospitals for another 10 years and basically setting up their infrastructure and their um, electronic medical records. Before that, I was with the financial industry for about 20 years. So this year culminates in a 40-year experience, basically.
That's awesome. So looking at your journey and your vision, you've worked across all these different industries. What inspired your journey into digital transformation, and how did you see health informatics as that natural bridge between the different fields?
Yeah, so this is a good question because I did not start, of course, in health informatics. I started as an engineer doing some stuff with the electronic side of computers. When I started, computers were just announced, somewhere in the 86, 87 time. And I learned the trade, and the first customers were actually banks and lawyers. So the banks were interested in Lotus 123. This was one of the first spreadsheets that you will power up the computer and you have to wait until it warms up and then pulls up a spreadsheet and then you enter data and you hope it comes up. And the WordPerfect, I don't know if some of you remember WordPerfect, but WordPerfect was the base of the digital transformation at the time, but they didn't call it that, but for the law offices, where it was a way to record all the transactions and record all the debates and whatever they had in cases. So fast forward, through all the evolution of computerization and computer at every house in 1995, information at your fingertips around 2000, and then about 2005 is everybody has a handheld device. So now we're doing things in gaming and all that, and then we get into about lately 2020 till now, about 5 year increments. We got into now artificial intelligence. So basically, transformation is basically what this industry went through. Okay, so we see over and over again, whether it's in telecom, where I started, whether it's then financial services and then healthcare, we see all the willingness of people to use less paper and more digitization, and that's actually the transformation. However, in the process, you're also doing transformation with people. Okay, that's one of my basic um, success stories I share with people is um, you're not transforming technology, right? Because technology doesn't transform. It's actually a tool to get things done. But you're transforming how people and cultures are built. Okay, so you're transforming people from saying, "Oh, I'm afraid of this, I don't like that, and I'm not sure how this is going to impact me," etc. Transforming it to a point where now they're reading it, they're seeing it through communication. You're communicating with them. You know what their uh, needs are, then you try to match adoption with the need. So it becomes, instead of moving from a place where they did not know it existed, or they're used to it, and then to a place they don't know it existed, you're moving from a place that they are used to it to a place they want to go to it.
Mhm.
So basically, it's a necessity, it's no longer a need. And once people get to that, they have transformation. You transform the people first and the culture. And then you go into transforming technology through process innovation, process improvement. Then you get to the technology side. So basically, the people, process, technology triad still applies.
I didn't even think about that from the engineering perspective, the benefit of that knowledge and taking it and applying it to we'll just call it the challenges of healthcare. Um, Thinking of like banks and ATMs, a lot of our viewers may not, or listeners may not remember a time when there wasn't an ATM on every corner. I do. I do remember when you still had to go into the bank and talk to the tellers in order to pull out any money, and my parents like writing out on their checkbooks. So I didn't even correlate that kind of experience. That's very beneficial. That's a great way for people to connect back to the importance as far as like the overall impact of technology on the world, really.
Yeah, to your point, Katie, things have become more, I would say, democratized for the word of getting everything in our hands, right? So before we used to look for information, information comes to us. We used to stop. I remember also getting a page, right? When I'm going on a service call, getting a page, having to stop the car, go look for a payphone. If not, just go to the next, gas stations get to call my office to have what is going on. So now instead of that, I just answer the phone call. Same thing, it's happening, right, with everything else, right? Healthcare. Instead of going to the lab and going to the doctor and going to here and there, now I can get it on one portal, etc. So information are coming to us.
Yeah, it's pretty
Yeah.
amazing what we're able to do. With your experiences, what kind of roles or opportunities do you see emerging for like students and professionals who want to enter health IT in the digital transformation space, or even people who are considering a career change into a field and, want to make an impact?
There are two sides of this. Either you change the field that you're in and you get into a field you like, and then you get into the digital side of that field or the information side of that field, or you stay where you are in the field and improve it into the digital side. So I've seen, for example, people in nursing, okay, getting into the technology of nursing informatics now, it's getting to be out there. Then clinical informatics, so basically a doctor, practitioner is actually learning how to do these things, whatever he used to do on technology. Example, if you're a dentist, right, you've seen a lot of, or if you're a dental student, you've seen a lot of dental practices now getting hands off. You can build anything first virtually, and then you put it in the patient's mouth. So everything is becoming like this, right? So even if you're a surgeon nowadays, you can build through artificial virtual reality, artificial intelligence, you are forming or performing the operation without touching the patient first. So what I say is, if you don't like the field, but you like the technology, wait long enough, the technology will come to the field you're in. Okay. And and that's how the world's going now.
For real world impact, could you share a story where digital transformation or informatics brought about a significant change, whether that's in patient care, in organizational efficiency, or innovation? And what about that left a lasting impression on you?
Thank you, Katie. Yeah, that's a moment when I said what I was practicing this 10-year period of my career in this field. I said to myself, this is what I'm going to take to my grave. So I'm going to share it, right? Because it was impactful, it was very sensible, and it made a big difference. So the story is about a 911 call, right? You make a 911 call, and there is a dispatch. Now, this contextual case was in a healthcare dispatch. So somebody had an accident, either in a car accident or some physical accident or a personal event, and they call a 911. So we have to send help. There is a big difference between what I ran into as that institution used to take the information by hand, right? It was in a developing country, and I take pride in having moved it light years later through my approach. So they used to take the dispatch by hand, track the ambulance by hand, track the patient information by hand, direct the ambulance because there was no GPS at the time that can dispatch. That's a global positioning integration for the dispatch center. They can dispatch to the right place. So imagine a place also with no physical address. Somebody had an accident on a street corner, no physical address. How can you map and match what you need to do? So we started there. We started in automating the whole process from getting a call into the triage, into the dispatch, tracking end to end, and then making sure that we get to the patient within 8 minutes or less. That was the edict that we had to do to make sure the patient doesn't go brain dead or something. So that was achieved, right? For 3 years, I worked with that organization that had about 8,000 people, that mostly volunteers, to put this in place, right? Once we got there, now we saw value in having information. So we started then developing the preemptive and predictive kind of thinking. And that was revolutionary in that context. So we got data, we put data on maps, okay, through GIS systems, geographic information systems. And now rescuers and people who doing EMT work, right, emergency medical technicians, are actually learning and exposed to all the data and information, and they're realizing that they can do a lot with it. So they were helping each other and helping the administration to say, okay, we want this, we want that. So we ended up with their input, launching a one of a kind in that area. I'm talking 2010 to 2018, and I'm talking somewhere in Eastern Europe. So what we did, we launched a predisposition plan for certain services. So, example, um, if the system would say between 4 and 6 p.m., this congestion happens here in this area, and it's in most of the cases of accidents happen there. So congestion and accident means resources can't get there, cannot get there on time. So the system said put some two ambulances in that place, so one gets dispatched, the other one's waiting, and vice versa. And then that will help you shore up that key metric of 8 minutes or less. And that was done. Okay, we used to be anywhere between 8 and unpredicted time and 20-25, depending on the time it takes for a resource to get to the site, to the incident location. So what does that mean? That means we made the transformation. Okay, so the combination of people and technology and the willingness of the collaboration and how the technology came about, and we implemented, cool stuff, but not just that. We also actually implemented the 8 minute or less. So everywhere in that country, there was 8 minute or less because we put that edict on that technology to help us get there. And after 10 years, there is no one paper in the whole department. 8 minutes or less, we're getting to the patients. So basically saving patients' lives. And we know how to learn from it too, because you look back at the data. This is what digital informatics is about, right? They say digital informatics because digital can be anywhere, right? So basically it can be in a clinical setting, it can be in a emergency setting, it can be also in a business setting. Now you know from that data set into how it's going to happen in the future. So this feedback loop and the learning loop is what made the transformation. So I'm proud of that and happy with the opportunity that I got to do this kind of work.
That's enormous. That's amazing to have that kind of thing. I didn't even know that. That's pretty awesome.
Thank you.
Um, Speaking of, I remember my mom had a cell phone and worked at one of the hospitals when I was a child, and she'd just gotten the phone and we saw a really bad accident that like blocked off the entire interstate. And I was like, use the phone. But that was before people had even really thought about it as like an option because it was so uncommon for folks to have cell phones. Um, so it's definitely made a huge impact everywhere. Um, Looking at the future, as far as where the industry is going and as it evolves with AI and interoperability, with cybersecurity challenges, what key skills or certifications would you suggest to prioritize and grow in the field?
Yeah, first, what I encourage everyone anywhere is to upskill themselves every year. You cannot survive in an environment where it's growing so fast while you don't know what is going on out there. Okay, so upskilling every year. It really doesn't matter in what. As long as you know your way, you upskill yourself, and then you're gonna get exposed with all the innovation and the new challenges. Specific though to AI, I would I think for me, AI at the moment, it's taking the first leap. Okay, so the first leap was from, again, let's get it started, let's launch it everywhere, talk about it everywhere, and see what happens. Now, to see what happens has happened. Now we see AI or artificial intelligence, like any tool out there, is full of um, defects from a point of view of getting the right data in the right hands at the right time. There is no way really to segregate data, bad data from good data. So here is a future potential for whoever is listening. We need that kind of talent is where to start crafting ways to curate data and feed it to AI because AI is ready from a point of view of a machine processing quickly. That's what it is. But now, what is it processing and what is the expected outcome? If the outcome gonna make sense, then data has to be real. It's very mixed now. So to answer your question, I think any um, good education and focus on how to make AI possible with good data, from a cybersecurity perspective, securing data with role-based access. I mean, I don't know how far you want to go here, but I mean, we have a lot of material, right? So role-based access control to make sure that not everybody has access to data they don't need to, and so they don't corrupt it either. So it has to be more of a balanced access. That is something that I'm working with the international community on to make sure we impose a justifiable use contexts to AI. Basically, is the data justified to be used in this context or not? Because really, they don't care what my color of my eyes was when I bought a certain car, right? So my information about color of my eyes should be private to me. This kind of segregation of data is important. So any specialty that goes into deeper into data segregation, data protection, cyber analytics to protect from external intrusion, or also data separation to protect from accidental mixing of data. So then you're exposed to all this control, compliance. Um, so, and whoever is listening to this, I would invite them to look at the AI framework, risk management framework at the moment, because this is the baseline, the first keystone, and what's happening next. The AI risk management framework is a framework that is an international effort. Of course, the European Union and the US are leading that effort to make sure that we have AI that is trusted, is trustworthy AI framework. So check it out. I believe it was 1.0 was launched last year in January. Check it out. And, this is a recommendation that will tell you where you want to go, what are the skills you need, because there's a lot of need out there. Thank you.
So, looking at your history with leadership and your career, what has been the most rewarding part of leading digital transformation initiatives?
Building trust, I would say number one. So building trust has to be for sure with your customers to start, okay? Because they just look outward with your customer. Customers have to trust you so you can transform their world, right? And we talked about that. We talked about the necessity of knowing where people are, what they're afraid of, and how to take them from the need to the necessity, where they are now aware that actually you have taken them to a different place and they have to get comfortable with it. So the trust of your customer in you, but it's not as important. Trust in your leadership is not as important as trust in you as a leader. So I've been, asked this question is, do you trust your manager? It's not important. You gotta trust them, of course, but you also are getting paid, so the trust is getting verified with the payment coming. But you never know if your team trusts you or not. You gotta groom that. You gotta make sure that you're there for your team. The team has to be exhibiting a trait that they trust you no matter what, and that's psychological safety. If you don't have that, you don't have leadership. So it doesn't matter what you do, right? And I've had situations where I've seen people lose that trust, and I saw what happened. Yeah, they cannot govern anymore. And the idea that leading has to be trustworthy scares people because then it's a responsibility.
Absolutely. What would you suggest for people that are coming into the field that are now being faced with all of these challenges as they come in? How would you anticipate that they should form these bonds with their teams? That way it can be authentic and genuine to actually build that trust despite what may occur in the workplace or in the field as it changes.
Great point. Great point. It's very intimidating, right? And when you know what's asked of you, then it's sometimes you take action that may not be well rewarded, and that is okay. What I would say is take risks, take actions, and listen to your team. If if you start taking action, let's just say, and the team pushes back, you got to understand why they're pushing back. And if you lean in to understand, then you'll be understood. The next time, maybe you either adjust your way or they adjust their perception of you. And it's all a back and forth conversation with your team. Now, your team could be local, the team could be virtual, your team could be 100 people, could be 1,000 people. It's not always easy, but at least you start what you can. And once you build it, it becomes feasible.
Absolutely. I think it's important to remember that most people intend well, and perhaps that they may not have understood some direction. So I try to give folks the benefit of the doubt. Um, and I think that helps as far as maintaining and establishing trust, because it can be very intimidating to come to a peer or a boss and say, I'm not sure about this. So I think that's a very good advice for folks is building psychological safety in that way. If you could redesign healthcare and IT systems from today, from scratch today, what would you do differently to better serve patients and providers?
Good question. Um, so I'm going to think back to my engineering self. Okay. So in engineering, you start with lines and boxes. So start from scratch. You're lucky. But whatever we did on the healthcare system, we started independently. So now getting back things to connect together, it's not as easy. So you got to have interfaces for everything. So what I would say is if we had to redo it again, I would start with interoperability, meaning I gotta build something where everybody agrees on. And by definition, the definition of words and definition of terms to what the data means. So I think a big step into that is the ICD coding that they, have finally got to decide on and say, okay, code X and code Y means the same, doesn't matter what language, and it doesn't matter how it's written, good. But that doesn't stop here. Interoperability is a big problem. You know, uh, uh, it has to do also with the practice, the culture, the patient case. So all of it enter into the problem and it makes it complicated. We talked about, FHIR and we talked about HL7. Okay, so they're starting, but they're still not there yet. I still see doctors saying, okay, well, they said this, maybe they mean that. When you do that, you don't trust what is out there, then you start making things up. Then you stray even further from making things up, meaning definition of words and practices. You stray even further from interoperability. So if I had to rebuild this, I would start there. Dictionary of terms, definition of terms, and grow from there. But we have to live with it. I think it's going to be for another 20 years, at least.
It's a long time. I hope we can get it done faster. I think it's a good point to bring up the interoperability and the real need of more natural language processing information out there. Um, I think one of the things that we would have been lacking back then would have been the global communication aspect. The medical community, I think, did have, some globalization, but not every aspect of it, of course. What do you see coming up with the future for you?
Oh, I hope that I continue to be able to give back to this profession. Um, I started a very novice. Okay, so the reason I'm going to go back a little bit where I started and see where the future is going because it has to be somewhere progressive. And everybody ought to look at that and look at it. I look at it every year. You see what happened and what could happen. So I started not knowing what I'm doing. Okay, honestly, I was 20 years old. I graduated from engineering school and I know how things work, but I don't know what they do. I don't know how they do it. I don't know who buys it, who's interested in it. So when I got dunked into the business aspects of something, I had to learn it all from scratch. So I learned how computers work from a sales order backwards, right? Reverse engineering. So what I suggest here is that use what you know to reverse engineer what you don't know into what you know. And then that way it piles up back. And then you check if you're right. And then over time, you have to find yourself. I don't know if I'm answering the question directly, but I'm going back to my inner self. So that moment, you have to find your mission in life, right? You have to find what you're made of, because this is where, what you're made for also. This is where you don't have to work that hard. So you get to learn what's around you, and then you apply what you are into what's around you. That's it. Everything will come in an evolutionary manner. And then going back to the point where you have to upskill yourself every year, I continue to upskill myself every year, even after 40 years of practicing this crazy industry. Okay, so I'm going to conferences, I don't do as much certifications anymore, honestly, because I don't know where to take that. But like, I'm not gonna go certified in coding in Python. That's for me, it's not there. It doesn't link to my self. So I go to conferences. It does a link of a personal ability, how to talk about things, how to discuss things, create connections. I go to conferences quite a bit, 4 or 5 every year. That's how I'm upskilling myself every year.
Absolutely. And that brings in new connections and new ideas, that you learn from everybody. For the next part, we've got some rapid fire questions. Would you
Okay.
pick a book or a podcast?
Uh, Honestly, a book.
Book, paper,
Yes,
Kindle,
paper.
paper. Is that always paper, or do you sometimes read electronic as well?
If I'm faced with an electronic, I look at electronic. But I like to go back to detox. So I read the paper anytime. I read it under a tree. I read it without power. I read it under the light uh, I don't know, a candle. But I just detox from technology. I need that every once in a while.
Absolutely. Would you choose the mountains or the ocean for a vacation?
Both. Okay, both. A mountainous place that has a view on the ocean, that's perfect. I don't know if it exists in a lot of places, but the ocean is, for me, is much more calming.
I think the only place I've had been that's had both was California. I'm not sure. I guess in many places in Europe you would have both. Would you choose going out to eat or cooking yourself?
Out to,
And do you prefer flying or driving?
if I can get there within driving in one day, I'll do it. If not, I'll fly.
Would you prefer impromptu vacation or planned?
I've never had a planned vacation, so I don't know how it works, but I've always tucked in a vacation at the end or the beginning or the middle of a certain trip. So this maybe is an impromptu. Okay, maybe.
Kind of a carrot at the end of a long like section of life.
Yeah. So if I'm going for a conference, I'll tack on one day before, one day after, and have fun. If I'm going, somewhere for fun, I'll have always something that talks about business. So maybe that's the way I am, but I never said, from that date to that date, I'm gonna go sit somewhere and do nothing. I, that can't be done for me.
Agree. I definitely am one of those folks that tries to plan out anything I can see there. What is your favorite place you've been so far in your life?
Wow. The utmost favorite is Portugal. When I was there, actually, okay, see, so the reason for being there, I was there as part of another trip like usual, but I said, I gotta hit Portugal. And the reason why, I don't know anything about it. It's really, you don't hear in the news anything about any vacation in Portugal. And I know a lot of good Portuguese people, especially live in Brazil, but they moved around. And I said, I gotta see what it is. And I left my trip after 4 days, tears in my eyes. I was surprised how that country and the people in there and the joy of life is permeated there. So I'll go there anytime. It's one of my favorites now.
Absolutely. I felt well, the first time I went to a carnival, if I'm saying it correctly, I never experienced the amount of joy that is just, it's palatable. I would suggest it for anybody because it is an amazing experience. Well, do you have any words of advice for us as we head into the future?
Well, the advice I give myself is take it a day at a time and don't lose sight of the values that you bring to the table. And the future is just another chapter of progression for us. So I never fearing the project, the future. It's not enigma for me. It's just, okay, I'm ready. What's next? That kind of thing. And if you approach, in my opinion, if you approach the future in that way, it's just another day in my growth, right?
Absolutely. Well, thank you, Dr. Nabil, for attending with us here at HIAC, Dr. Nabil, and we look forward to seeing you in the future. Is-
Thank you for having me.
Okay.